Schizophrenia is a chronic brain disorder that affects how a person thinks, feels, and behaves. It can make it difficult to distinguish between what's real and what's not, often leading to hallucinations, delusions, and disorganized thinking. Approximately 1 in 300 people worldwide live with schizophrenia. While it is a lifelong condition, modern treatments are helping patients live more stable and fulfilling lives. In this video, we'll explore the symptoms, causes, and challenges of schizophrenia to Cobenfy, a new medication that's changing how we treat this disorder. Schizophrenia presents in 3 major ways. The first way schizophrenia presents itself is through positive symptoms. These are experiences that add to a person's perception of reality. It consists of 7 key symptoms such as delusions, conceptual disorganization, hallucinatory behavior, excitement, grandiosity, suspiciousness, persecution, and hostility. The second way is through negative symptoms. These are behaviors or emotions that diminish over time. It consists of 7 key items that assess the severity of negative symptoms commonly associated with schizophrenia. These include blunted affect, emotional withdrawal, poor rapport, passive apathetic social withdrawal, difficulty in abstract thinking, lack of spontaneity and flow of conversation, and stereotyped thinking. Social withdrawal, avoiding friends and family. Reduced motivation, loss of interest in daily activities. The third way is through cognitive symptoms. These affect a person's ability to think and focus. Memory problems, trouble remembering details or conversations, difficulty concentrating, inability to stay focused on tasks, poor decision-making, struggles with processing information. Managing these symptoms is challenging, but with the right treatment, patients can improve their quality of life. The exact cause of schizophrenia is still unknown, but researchers have identified several risk factors. Genetics. If schizophrenia runs in a family, the risk increases. Brain chemistry. Imbalances in neurotransmitters like dopamine and glutamate. Environmental triggers. Trauma, stress, or exposure to infections during pregnancy. Substance use. Some drugs, such as cannabis, may increase the likelihood of developing schizophrenia. While these factors increase the risk, they don't guarantee that a person will develop the condition. Early diagnosis and treatment are key to managing symptoms effectively. People living with schizophrenia often face significant challenges. Social stigma. Many misconceptions about schizophrenia lead to discrimination, difficulty holding jobs, cognitive impairments make employment challenging, struggles with relationships, maintaining friendships and family connections can be difficult. Medication side effects. Many traditional treatments come with unwanted effects. Despite these challenges, advancements in medical research have led to newer, better treatments. This brings us to Cobenfy, a groundbreaking medication offering new hope. Cobenfy is a new FDA-approved medication designed specifically to treat schizophrenia. Unlike traditional antipsychotics that primarily target dopamine receptors, Cobenfy works through a unique mechanism involving muscarinic receptors. By stimulating muscarinic receptors, Cobenfy helps regulate brain function more naturally, reducing both psychotic symptoms and cognitive impairments. This means patients may experience fewer side effects compared to older medications. Cobenfy contains 2 key ingredients: Xanomeline, a muscarinic receptor agonist that helps balance brain activity; Trospium chloride, a compound that prevents unwanted side effects outside the brain. This dual approach allows Cobenfy to reduce schizophrenia symptoms while minimizing side effects often seen with traditional antipsychotics. Studies have shown that Cobenfy can help with reducing hallucinations and delusions, enhancing motivation and emotional engagement, improving cognitive function, including focus and memory, lowering the risk of weight gain and drowsiness. Because it doesn't primarily affect dopamine levels, it avoids many of the movement disorders associated with older schizophrenia medications. Cobenfy is designed for adults with schizophrenia, particularly those who experience severe side effects from traditional antipsychotics, need improved cognitive function in addition to psychotic symptom relief, have both positive and negative symptoms that require balanced treatment. Always consult with a doctor to determine if Cobenfy is the right treatment option. Nausea and vomiting, constipation, dry mouth, increased heart rate, urinary retention. However, Cobenfy's unique mechanism makes it less likely to cause severe neurological side effects compared to older treatments. Cobenfy represents a breakthrough in schizophrenia care because it avoids movement disorders seen with dopamine-blocking drugs, improves cognitive function, which older medications often neglect, provides an alternative for patients struggling with traditional treatments. The introduction of Cobenfy marks a new era in schizophrenia treatment. Scientists continue to research even more targeted therapies, aiming for better long-term solutions. As we move forward, patients and their families can look forward to safer, more effective treatments that improve quality of life. Schizophrenia is a complex condition, but new treatments like Cobenfy are transforming the way we manage it. If you or someone you love is affected by schizophrenia, talk to a healthcare provider about the best treatment options available. Remember, mental health matters. With understanding, medical advancements and support, individuals with schizophrenia can lead fulfilling lives. Thank you for watching. Stay informed, stay supportive, and never lose hope.